Let's talk about something that's, well, pretty terrifying: sudden chest pain. It's one of the biggest reasons people call 911. But have you ever wondered what happens the second that call goes through? A very precise, high-stakes clock starts ticking. In this explainer, we're going to pull back the curtain and walk you through exactly what paramedics do, step by step, when a life is on the line.
So the clock starts now. From the moment those paramedics walk through the door, the next 30 minutes are this incredible whirlwind of critical thinking and life-saving action. Let's break down that timeline, and you'll see how first responders turn total chaos into a controlled procedure designed to save a life.
First things first, detective work. Seriously, the moment paramedics arrive, they're not just medics, they are investigators. Their first mission is to gather as many clues as possible, as fast as possible, to figure out what's really happening inside your body.
And they start by asking a ton of questions, rapid fire. Your age, any past heart attacks, diabetes, all of these are huge clues. But then they'll ask about medications that might surprise you, like Viagra or Cialis. And you might wonder why. Well, it's because those drugs can cause a catastrophic drop in blood pressure if they're mixed with certain heart medications. It's an absolutely critical piece of the puzzle.
Next, they're scanning for all the telltale signs. Because it's rarely just chest pain, right? They want to know, is it a crushing pressure, a tightness? Does the pain move? Does it radiate to the jaw or the arm? Is the skin pale and sweaty? Is there any nausea or shortness of breath? Every single symptom is another piece of that puzzle they are piecing together in real time.
Now, here's a really critical distinction they have to make. Are we looking at angina, or is this a full-blown heart attack? You can think of angina as like a temporary warning shot. It's a brief lack of blood flow that's often brought on by stress and goes away with rest. A heart attack, a myocardial infarction, that's the main event. That's a total blockage where heart muscle is actively dying, and the pain is constant. It doesn't stop.
So once they have their initial clues from all that detective work, it's time to open the toolkit and start the critical life support interventions, right there on the scene. These first 3 steps are pretty much universal. First, they check your oxygen levels. They'll only give you oxygen if you're short of breath or your levels are below 94%. Then comes a full dose of aspirin. And third, they'll establish an IV line. This creates a direct highway into your bloodstream, getting it ready for any fluids or life-saving medications that might be needed down the line. You will almost always hear them give this specific instruction: chew the aspirin. Why? It's actually a simple but brilliant little trick. When you chew aspirin, it gets absorbed through the lining of your mouth directly into the bloodstream. It works way faster to start preventing blood clots than if you just swallowed it whole. So while all this is happening, they are constantly monitoring your vital signs, and this number right here is a huge one: systolic blood pressure, or SBP. That's the top number on a blood pressure reading. If that number drops below 110, it's a major red flag for what's called hypotension, dangerously low blood pressure. And if that blood pressure is too low, they don't wait. They respond immediately with a 250 milliliter fluid bolus. It's just a rapid infusion of saline solution through that IV. Think of it like this: it's like adding more water to a garden hose to get the pressure back up. It's a simple action that can make a huge difference in making sure your vital organs, especially your brain, keep getting the oxygen they need. Okay, so all of the initial assessment, the questions, the stabilization, it has all been leading up to this moment. This is the single most important diagnostic tool that paramedics have in the field. It is time to hook up the 12-lead ECG and get a direct look at the heart's electrical story. And the main thing they are looking for on that ECG is this: a STEMI. STEMI stands for ST elevation myocardial infarction. To put it simply, this is the medical term for the big one. It's the most dangerous type of heart attack, where a major coronary artery is completely blocked. So, how do they spot it? They're looking for something that looks like this technical jargon on the screen. It's called ST segment elevation. I know, it sounds complicated, but for a paramedic, seeing that on the screen is like the ECG is literally shouting at them that a major artery is blocked and heart muscle is dying right now. This is the definitive, game-changing clue. And finding that definitive clue on the ECG creates a critical fork in the road. The diagnosis of a STEMI completely changes everything that happens next, from the kind of medications they can give to which hospital they're going to race to. You can see here it creates 2 totally different paths. If it's a yes, a confirmed STEMI, a STEMI alert goes out. This means the paramedics will bypass closer emergency rooms and drive straight to a specialized cardiac center, where a cath lab team is already waiting for them.
If it's a no STEMI on the ECG, the goal shifts. They'll focus on stabilizing the patient and transporting them to the nearest appropriate hospital.
Now, during that transport to the hospital, they're still working. They're managing symptoms. They might give nitroglycerin under the tongue, help open up blood vessels. But, and this is a big but, only if that blood pressure is stable and above 110. For severe pain, they can use morphine. And if there's nausea and vomiting, they've got ondansetron. Every single medication has a very specific job to do.
So this brings up a really important question. If the ECG doesn't show that big, obvious STEMI alarm bell going off, does that mean everything's okay? Does the patient just get a routine, less urgent ride to the hospital? Well, not necessarily. Not at all, actually.
The big takeaway here is that even without a confirmed STEMI, things can still be incredibly serious. A patient will still get a full advanced life support transport if the chest pain is severe and ongoing, if the ECG is showing other worrying signs like an irregular heartbeat, or if they need IV medications to stay stable. And at the end of the day, paramedics can always use their professional judgment to provide that higher level of care if they think it's needed.
Okay, so let's just recap for a second. We've seen how paramedics instantly become detectives. We've seen how they use a precise toolkit to stabilize a patient on the scene. And we've seen how a single reading on an ECG can change absolutely everything, kicking off a race against time to get to the right hospital. It is an incredible protocol, all performed under immense pressure.
So after seeing this entire complex expert system in action, what's the single most important decision in this whole process? It's actually the very first one. It's the decision to pick up the phone and call 911 without hesitation. Because every single life-saving action we just talked about depends entirely on you to start that clock.